Hey guys, and welcome to How to Gastro. So in today's video, we'll be discussing quite an interesting topic, and we'll be talking about what is a liver function blood test, which is also commonly known as an LFT. So let's get started. So before we get into the specifics of the liver function blood test itself, let's talk a little bit about what you can expect when your doctor orders this blood test for you. So a liver function blood test is a simple test that can be done at your closest laboratory or hospital. No special preparation is needed for a liver function blood test, which means you don't have to fast, so you can eat and drink as usual before the test. During the test, a blood sample will be collected from you, which means a needle will be inserted into a vein, usually in your arm, to draw out some blood into a gold top or SST blood tube. This blood is then sent to a laboratory where it is analyzed and resulted. So what is a liver function blood test? A liver function blood test, also commonly known as an LFT, is a group of blood tests used to assess the health and function of the liver. This group of tests measure the levels of certain enzymes, proteins, and substances in the blood that are either produced by the liver or affected by the liver function. So the full panel of results help doctors determine if the liver is functioning properly or if there is any damage or disease that is affecting the liver. So from this definition, we understand that the liver function tests are actually a group of tests that measure enzymes, proteins, and substances that are either produced by the liver or affected by liver function. And essentially, these are the key components for diagnosing and investigating liver disease. So let's talk a little bit about the components of the liver function tests. So the liver function blood test is made up of several components, including number 1, the Alanine Aminotransferase or ALT blood test, and this is an enzyme that is found in the liver. Number 2, the Aspartate Aminotransferase or AST blood test, which is another enzyme that is found in the liver. Number 3, Alkaline Phosphatase or ALP, which is an enzyme related to the bile ducts within the liver. Number 4 is Gamma-Glutamyl Transferase or GGT, which is also an enzyme that may be elevated in liver disease. Number 5 is Bilirubin, which is a waste product that is produced from the breakdown of hemoglobin. Number 6 is an albumin blood test, and this is a protein that is also produced by the liver. And finally, number 7, which is prothrombin time or PT, which is also a blood test that measures how long it takes for the blood to clot. So these are the several components that make up the liver function test. So let's explore each of them a little further. So what is ALT or alanine aminotransferase? So alanine aminotransferase is an enzyme primarily found in the liver. It plays a crucial role in the process of converting alanine, which is an amino acid, into pyruvate, a key intermediate in energy production. So when the liver is healthy, the ALT levels in the blood are typically low. However, when liver cells are damaged or inflamed, the ALT can leak into the bloodstream, leading to elevated levels. So normal ALT levels. The ALT levels are usually measured in units per liter of blood. So in men, the range is typically from 10 to 40 units per liter. And in women, the range is usually from 7 to 35 units per liter of blood. So what causes elevated ALT levels in the blood? At number 1, we have liver conditions. So hepatitis, like viral or autoimmune hepatitis, fatty liver disease, liver cirrhosis, or liver cancers all cause elevated ALT levels. Other causes include medications such as statins, antibiotics, or certain over-the-counter pain relievers, which can cause liver damage and elevate the ALT levels. And the third cause here is other conditions, which is made up of heart failure, muscle injury, or pancreatitis. So what is aspartate aminotransferase, or AST? So aspartate aminotransferase is also an enzyme found in various tissues throughout the body, including the liver, the heart, the muscles, the kidneys, and the brain. So like ALT, AST is involved in amino acid metabolism, helping to convert aspartate and alpha-ketoglutarate into oxaloacetate and glutamate, which are also important in the energy production process. So what are the normal AST levels? So AST levels are also usually measured in units per liter of blood. So in men, this range is typically from 10 to 40 units per liter, and in women, this range is typically from 9 to 32 units per liter of blood. So what are the causes of elevated AST levels in the blood? So here we also have liver conditions like hepatitis, which include viral, alcoholic, or drug-induced hepatitis, fatty liver disease, liver cirrhosis, or liver cancer. We also have heart conditions like myocardial infarctions or heart attacks or heart failure. We also have muscle conditions, which include muscle injury or trauma, or muscle diseases like muscular dystrophy, and other conditions which include pancreatitis, kidney disease, and hemolytic anemia. So now let's talk about alkaline phosphatase, or ALP. So alkaline phosphatase is also an enzyme found in various tissues throughout the body, with the highest concentrations in the liver, the bile ducts, the bones, and in the placenta of pregnant women. So ALP plays a crucial role in the breaking down of proteins and is involved in the process of dephosphorylation, which is essential for various metabolic functions. So what are the normal ALP levels? So ALP levels are also usually measured in units per liter of blood, and in adults, the typical range is from 30 to 120 units per liter of blood. In children and adolescents, high levels here are normal due to bone growth. And in pregnancy, high levels are also normal here due to the placental levels of ALP. So what are the causes of elevated ALP? So here we have liver and gallbladder conditions. So we can have a bile duct obstruction due to gallstones or gallbladder tumors, liver diseases like hepatitis or liver cirrhosis, liver cancer or metastasis to the liver. We can also have bone conditions, so bone growth in children and adolescents, as we mentioned above, causes higher than normal ALP levels. Or we can have pathological conditions like bone diseases like Paget's disease or osteomalacia, or bone healing after fractures. And other conditions include pregnancy, as we discussed above, due to high placental levels of ALP. We also have hyperparathyroidism and certain cancers as well. Moving on to gamma-glutamyl transferase, or GGT. So gamma-glutamyl transferase is an enzyme found primarily in the liver, but also in the bile ducts, pancreas, kidneys, and other tissues within the body. So GGT plays a role in the metabolism of glutathione, which is a critical antioxidant and is involved in the transfer of amino acids and peptides across the cell membranes. So GGT levels in the blood are typically measured to assess liver function, particularly in the context of bile duct issues or alcohol-related liver disease. So this is quite an important point to note. So the GGT levels are also quite useful in identifying patients who suffer from chronic heavy alcohol consumption, as raised GGT levels usually point to chronic alcoholism. So what are the normal levels of GGT in the blood? So the GGT levels are also usually measured in units per liter of blood, and in men they range from 7 to 47 units per liter of blood. In women they range from 5 to 30 units per liter of blood, and in the elderly, levels tend to increase slightly with age. So what are the causes of elevated GGT? So again here we have liver and bile duct conditions such as alcoholic liver disease, non-alcoholic fatty liver disease, hepatitis, which includes viral, autoimmune, or drug-induced hepatitis, liver cirrhosis, and bile duct obstructions, which may be due to gallstones or gallbladder tumors. We also have other conditions like pancreatitis, congestive heart failure, the use of certain medications like phenytoin or the barbiturates, chronic smoking, and as we mentioned before, chronic heavy alcohol consumption. So moving along, let's speak a little bit about bilirubin. So bilirubin is a yellowish substance produced during the normal breakdown of red blood cells. It is a byproduct of hemoglobin, which is the protein in red blood cells that carry oxygen. So bilirubin is processed by the liver, which converts it into a form that can be excreted in the bile and eventually eliminated from the body in the stool. So there are two main types of bilirubin in the blood. They are the unconjugated or indirect bilirubin and the conjugated or the direct bilirubin. And the total level of bilirubin basically means that we've just added the unconjugated to the conjugated to give us the total amount of bilirubin in the body. So the unconjugated or indirect bilirubin is the form of bilirubin that is initially produced from the breakdown of hemoglobin, and it is not water soluble and must be processed by the liver to become conjugated. So we then have the conjugated or direct bilirubin. So this is the bilirubin that has been processed by the liver, making it water soluble, allowing it to be excreted into the bile and eliminated from the body. So normal bilirubin levels are usually measured in milligrams per deciliter of blood. So the normal range of the total bilirubin is usually 0.1 to 1.2 milligrams per deciliter. The direct or conjugated bilirubin is usually 0.0 to 0.3 milligrams per deciliter of blood, and the indirect or unconjugated bilirubin usually ranges from 0.2 to 0.8 milligrams per deciliter of blood. So what are the causes of elevated bilirubin? So here again, we'll have liver and bile duct conditions. So under this category, we have hepatitis, which can be viral, alcoholic, or autoimmune hepatitis, liver cirrhosis, liver cancer, Gilbert syndrome, which is benign and causes mild increase in unconjugated bilirubin, gallstones, bile duct tumors, or pancreatic cancer. We can also have an increased red blood cell breakdown causing elevated bilirubin, which occurs in cases of hemolytic anemia, sickle cell disease, or blood transfusion reactions. Another cause for elevated bilirubin is newborn jaundice. So this is common in newborns, often due to the immature liver's inability to process bilirubin efficiently. So these are all the causes of elevated bilirubin in the blood. Now let's talk a little bit about albumin. So albumin is a protein that is made by the liver that plays a crucial role in maintaining the osmotic pressure in the blood, which helps to keep the fluid within the blood vessels. It also acts as a carrier for various substances, including hormones, vitamins, and drugs, transporting them throughout the body. So normal albumin levels. So albumin levels are usually measured in grams per deciliter of blood, and the normal range in adults is usually 3.5 to 5 grams per deciliter. So now let's explore some causes of low albumin levels. So the first cause is liver diseases. So here we have liver cirrhosis, hepatitis, and liver failure. We then have kidney conditions, which includes nephrotic syndrome, which means our patient will suffer losses of albumin in their urine. And here we also have chronic kidney disease. We can also have nutritional deficiencies. So severe malnutrition or absorption or protein energy malnutrition will cause lower albumin levels. Another cause is inflammatory conditions. So chronic infections or inflammatory diseases, sepsis or severe burns will cause low albumin levels in the blood. And other causes include heart failure due to fluid retention and gastrointestinal diseases that cause protein loss, such as in cases of Crohn's disease or ulcerative colitis. And finally, the last component of the liver function test is the prothrombin time, or the PT. So the prothrombin time is a blood test that measures how long it takes for the blood to clot. It is used to evaluate the blood's ability to form clots properly and to monitor the effectiveness of blood-thinning medications like warfarin. The PT specifically assesses the function of certain clotting factors, including factor 1, factor 2, factor 5, factor 7, and factor 10, that are involved in the extrinsic and common pathways of the coagulation cascade. So normal PT levels measure the time it takes for blood to clot in seconds, and the normal range in adults is 10 to 13 seconds. So what are the causes for prolonged PT or PT above 13 seconds? At number 1, we have liver disease. So again here we have liver cirrhosis, hepatitis, liver failure, as the liver produces many of these clotting factors, so the liver dysfunction can and will lead to the prolonged PT. We can also have a vitamin K deficiency. So vitamin K is necessary for the synthesis of certain clotting factors, meaning that when we have a deficiency in vitamin K, it's going to lead to a prolonged PT. At number 3, we have the use of blood-thinning medications. So warfarin and other anticoagulants are intended to prolong the PT to reduce the patient's risk of clot formation in their body. At number 4, we have DIC, also known as disseminated intravascular coagulation. So this is a serious condition where the clotting factors are consumed faster than they can be produced, leading to both excessive clotting and bleeding issues in the body. So here we will also have a prolonged PT. And the last cause are factor deficiencies. So deficiencies in clotting factors like factor 1, factor 2, factor 5, factor 7, or factor 10 can and will also lead to a prolonged PT. And so the take-home message. So as we have just seen, the liver function tests are essential tools for maintaining liver health, diagnosing liver disorders, and guiding treatment through the management of liver-related conditions. By identifying issues early through liver function tests, healthcare providers can implement interventions that may prevent further damage, improve outcomes, and enhance the quality of life for patients. And that brings us to the end of this video. So thank you guys so much for watching. I hope you found this presentation very interesting and informative. Please make sure to like, comment, subscribe, and share this video with some of your friends you think might find this video helpful. So I've also just signed up for Buy Me a Coffee. So if you want to encourage me to do even more or to say thanks for all the free information you've received on my channel today, you can buy me a coffee. And you can do so by clicking the link down in the description box below. Take care and have an amazing day further. Bye for now.